What's going on, guys? Dr. Brian Larish here with the PT Growth Academy. And in this video, I want to talk about 4 myths behind a deadlift. And to get a little bit more specific and clear, when I say myths, I'm actually talking about mindset. So I want to talk about 4 different mindsets that I want you to have when you're either coaching or performing a deadlift. Myth number 1, squatting the deadlift. A lot of times we feel that we can take our squat form and transpose it on top of our deadlift technique. In actuality, the deadlift and the squat are like apples to oranges. They are 2 totally different movement patterns. You really need to make sure that you understand that the deadlift needs to be very horizontal while the squat needs to be very vertical. So you need to make sure you have the steps in place to ensure that your patients or you can hinge properly, right? So you need to be able to hinge so that when you go into your deadlift, you're not just squatting the deadlift. When this happens, you'll typically find a quick recipe of low back pain and decreased performance because you're not as strong compared to that good hinge mechanics. So really make sure that you understand the difference between the two and that you're not just squatting your deadlift. Myth number 2, pulling your deadlift. Now, this may sound contradictory, but the mindset shift here is that I really want you to think about pushing into the ground instead of just pulling the weight. Yes, you do have to pull the weight up, but I want your mind to start thinking about pushing into the ground. And if it helps, think about your feet pushing into a leg press if you were trying to push a leg press away from you. What this is going to do is promote internal rotation. And when we have internal rotation, that's going to produce power. So that is our power mechanism. So instead of just pulling, which is going to typically lead to a lot of extension and a lot of initiation through our spine compared to our hips, I want you to think about pushing into the ground to try to produce as much power as you possibly can. Myth number 3, you must perform a traditional deadlift. Now, if you're working with a power lifter or a competitive athlete, then yeah, you may follow techniques that align with the traditional deadlift because it's part of their sport. But the majority of the time, that won't be the case. So the mindset shift that I want you to have here is to consider 2 key variables, and they are biomechanics and goals. When it comes to biomechanics, understand that everyone is biased towards being a better squatter or a deadlifter. And what dictates that is the positioning of the pelvis, the rib cage, and their overall patterns. Now, if you really want to understand that more, I encourage you to check out our Performance Redefined course, where we have 8 weeks to go into a lot more detail. But if you are working with that patient that is a better squatter, we know they're going to have a harder time with deadlifting, right? So we can make modifications such as replacing the normal barbell and using a trap bar. We can elevate the surface. Now, why would we want to do that? Well, we would typically need to decrease the range of motion so that they can appropriately hinge before they move into their familiar squat pattern. So, is that the right decision? Well, their goal is also going to play a factor here. Are you dealing with someone that is really trying to build strength? Or is it someone that is just trying to hinge and be able to move in a healthy way so that they can pick their groceries up without hurting their back? Right? So the biomechanics and the goals are really going to come into play to understand what type of deadlift should your patient perform, but understand that it doesn't always have to be a traditional deadlift. Myth number 4, head up. This is one of those obsolete cues that tends to be paired with chest up, head up, and we really just kind of have gotten away from it because we know it's just ultimately not the best cue. It drives a ton of extension in the wrong places. Yes, the deadlift, we are trying to move through hip extension, but the head up cue tends to overactivate the extensors of the spine. They start to pull the weight, which contradicts our pushing through the floor. So what happens is the back becomes that primary mover when in reality, we are trying to maintain the hips as the primary mover. So instead, think about having that neutral spine, that chin slightly tucked down. You can think about a tennis ball being under here so that when your patient moves, they're not initiating with their spine. They're keeping that in place and they're initiating and driving through their hips throughout the whole duration of the motion.